Today we will be discussing about epilepsy, a very common neurological disorder which we routinely see in our OPDs. During my interaction with patients, the first thing I have noticed is whenever we say that you are being diagnosed with epilepsy, they are not worried to know whether it is a what kind of disease it is, what has happened. They are first worried about the social stigma and the taboo attached to it. So that's why we must have first impression that epilepsy is just a neurological disease in which there is lot of treatment available. This is the first thing they should understand whenever this word comes out, not the associated social taboo, the associated side effects which can happen due to the disease. Because epilepsy is surrounded with many social myths and taboos. So it is a good platform to discuss what is epilepsy and what are the common symptoms of epilepsy. The most easiest way to understand epilepsy is that it's basically a neurological dysfunction happening inside our brain. So there are a lot of brain cells which are controlling all over our body functions, and these brain cells communicate to each other through electrical signals. So whenever there is the snap in between this electrical signal activity, there is a kind of short circuit happening inside the brain. It can present outside as a seizure, and when you have a tendency of recurrent seizures, we call it as a epilepsy. So if we have to understand it simply, so we have to understand basically some electrical disturbance inside the brain can lead to seizure. And if you have a recurrent tendency of getting a seizure, then it can be diagnosed as a epilepsy. So after you are being diagnosed epilepsy, what are the things you must do? First thing is, if there is a possibility of epilepsy and if you are at a peripheral level, then you must definitely at least once in your lifetime contact a neurophysician. Why? Because epilepsy often gets misdiagnosed also because there is an entity called pseudo seizures, which often we have seen that get misdiagnosed as epilepsy, and patients are kept on medication for their lifetime with that kind of diagnosis. So so for the confirmation of diagnosis, it's highly recommended at least in once in your lifetime you must meet a neurologist and do the tests as prescribed by them. They may ask you to do a neuroimaging and an electroencephalogram, which are the basic tests usually required to diagnose epilepsy. Apart from this, how do a common person know or understand that there is a possibility that my near and dear one or myself is having the symptoms of a seizure? So, to recognize seizure, you have to first understand it can be of various varieties, such as it can be a motor thing, it can be a sensory thing, or it can be an autonomic thing as well. The most common seizures, which are easy to recognize also, are the motor seizures, in which there can be a sudden jerking of the hand or the leg or a part of the face, which happens suddenly, and usually it will be like in a tonic clonic manner where there is a jerking or rhythmic movement happening. It can also lead to loss of tone and fall of the patient along with loss of consciousness can sometimes accompany these kind of seizures also. If there is a heavy electrical disturbance, it can lead to a generalized form also where both the legs, both the hand and the whole of the body is shaking or jerking in a very high frequency. So if such along with that, it can also lead to tongue bite with dribbling of saliva or the blood due to tongue bite can also happen. There is often a very characteristic signature symptom of epilepsy in which there is an uprolling of eyeballs, which is very common with these kind of seizures. Along with that, you should also see that there is a variety in which there can be complete loss of the patient's presence or concentration during that activity, whatever it is happening. It is called absence seizures. It usually happens in the smaller children, in school going children. Well, usually, when the child is actually working or taking down the notes or reading or writing or playing, and sudden there is stoppage in the activity, and quickly after a few seconds or a minute, suddenly the person gets back to the same place where that activity was lost. So these are the possible symptoms of seizure, and it should be dealt with seriosity. Accordingly, there is one more important thing you must understand, that seizure can happen when patient is alone. And if such a situation is there, and you have found the patient unconscious at any place, it is highly recommended, if the patient that area was under the CCTV surveillance, we must take a CCTV footage and look at the that pre loss of consciousness event of the patient. It's a very important diagnostic clue for the physician. So this also should be kept in mind. And if you are staying in a remote place and you are having some symptoms which are suggestive of seizure, then taking a videograph with the help of your phone can be helpful for diagnosis when you come to a doctor's clinic. So along with this, I would also give you importance of taking anti-seizure medication if at all you are diagnosed with seizure, because anti-seizure medications are your best friends if you are diagnosed with epilepsy, because that is the only drugs which can limit these electrical activities inside your brain and stop getting these seizures in future, and can be really life saving in some of the cases. Along with this, thank you so much for having me on the board. Thanks a lot.